Good Tuesday afternoon. Welcome to Portland Today. We begin with the amazing story of the Ferretti family and their effort to bring attention to congenital heart disease.
Yeah, Lily Ferretti came into the world in 2008, appearing to be a healthy baby, but 2 days later she had a seizure, which led to a devastating diagnosis. Amazingly, you see from the pictures here, Lily is an active 9-year-old, and we're happy to have her in studio with her dad, Jim, and her pediatric cardiologist, Dr. Mark LaGraw. Thank you all for joining us.
Thank you.
Jim, right up front, Lily told me Dad's doing the talking. so take us back to October of 2008 when Lily got her diagnosis.
You know, we had a perfect pregnancy. Everything was fine. And then we had, 2 days later, had a seizure of some sort. And we were transferred to what was then called Legacy Emanuel Children's Hospital. We spent several days in the NICU trying to figure out what caused the seizure. And on the 6th day, we were ready to take her home, and she wasn't unhooked from anything. And the doctor says to me, and my wife says, grab some tissues, says we better sit down. And that's when we found out that she had a heart condition. We didn't know anything about it at the time. And then we met Dr. LaGraw that night, or that afternoon, and he explained to us what it was, and it's called hypoplastic left heart syndrome. And in my basic terms, it means that she was basically born without the use of the left side of her heart. So she has half of a heart.
So Dr. LaGraw, I mean, talk about the seriousness of that type of condition, and you said it's actually quite common.
There's about 1,000 children a year born with it, but overall congenital heart disease affects about 1% of the population. So we estimate 40,000 children a year are born with congenital heart disease, and a quarter of those have what we call critical congenital heart disease, where they will require a surgery or a procedure in the first year of life. And Lily's condition in particular is lethal without any procedures or surgery. And we've come a long way from not being able to do much to having a nice, healthy young girl.
All such serious talk here, Lily, right?
So serious.
But you're doing well now, huh? Yes, with her doll kit to keep her company there. Is it typical, as in the Ferretti's case, doctor, that they had no knowledge of this prior to Lily being born?
It often is, and that's the beauty of the legislation that have been passed in the majority of states doing oxygen screening after the first day of life. That has picked up a huge amount of children who would have gone home, gotten deathly ill, and come into the hospital with a heart that was really sick and weak, who might not have done well with surgery. So, and in addition, we also are doing ultrasound screening of pregnant moms, and the obstetricians are being able to pick up that there's something not quite right with the heart, and then they involve us, pediatric cardiologists, to further define what's going on. So fortunately, we can pick people up.
Is there something that parents can look for? Obviously, you're testing, you're doing all the things that you should be doing, but are there things parents can really kind of see as a warning sign?
Sure. The difficulty is all of the conditions that we have where babies get sick can manifest the same way. Okay, babies don't have a wide repertoire, but in general, the babies are lethargic, so they're sleepy, they don't wake up much, they don't feed well, their fingernails and lips may be bluish, and they may not be breathing well, so they may be having labored breathing, rapid breathing, or just working real hard.
All things from the heart working too hard in this case, right? Because it's only...
Well, the heart's not able to do its job, and so all the organs are just not very happy. Right?
So, Jim, what has it taken over the last several years to have Lily be in this condition? I mean, several surgeries, I imagine.
It has been, like I said, 3 surgeries. She's also had a catheter procedure where they've gone in and blown up some arteries and some veins near her heart to make the blood flow better. We've had several ear surgeries as well, but it has changed me. 9 years ago, I was, just a mean little person. And she's,
no, you're not.
That's hard to believe.
Don't ask anyone that knows me.
I don't believe you.
She has changed me as a person because I know how much it takes for her to do things.
I looked at the correspondence in, you talking with our producer about coming on today, and it was just so important to you to get this message out because this is National Heart Health Month, and you feel like we do a lot to keep people informed of keeping hearts healthy, but there are people who come into the world such as Lily did. And I know that you also wanted to call attention to support groups that are available for parents.
We have a wonderful support group here in Portland. It's called Mended Little Hearts Portland. You can find it at greaterportland.mendedlittlehearts.net. It's a group of parents that have gotten together. It's a national organization, but locally a group of parents that have gotten together that provide support online, in person. We talk with each other about our problems, our triumphs, and we share our tragedies. And sadly, I've been personally to one child's funeral, but I've shared in several hundred funerals online. And so it is a very sad thing to have, but I wouldn't change her for anything.
Well, Lily, can I just say you have great fashion taste. I love your cowboy boots there. Your cowgirl boots, we should say.
We
Great
had a
job.
picture of her riding a horse, so we must like to ride horses.
Do you like horses?
Yes.
Yeah. All right.
Hey, we got a word out of her.
Right up.
Well, Doctor, thanks so much for being here.
Well, thank
Lily,
you so much.
you're almost done. And Jim,
Thank
thank you
you
for sharing your family story.
Thank you very
An
much.
important story. Thank you all very much.